And welcome. I'm Nicole Rate with Evergreen Certifications, and I am excited to be joined with Sean Smith today to be talking about our new certification in rapid response. So, welcome, Sean. Thanks for being here today.
Thank you so much for having me, and thank you so much for everyone viewing this video. Pleasure to have you here, and hopefully we can turn you on to a new and exciting way of approaching, industry standard information about deteriorating patients and how to stabilize them.
Absolutely. Yes, we've got a couple questions for you today. So, we'll start off with asking you about why somebody should get certified in rapid response healthcare.
And that's a real easy one because you just said the key words there, healthcare. There's very few practice environments where there's absolutely zero risk of experiencing the need for a rapid response. I've coded patients on airplanes. I've coded patients in waiting rooms of outpatient family practice offices. Obviously, as an emergency room ICU flight nurse paramedic, I've coded patients in all the environments that people normally associate with this. But more importantly, I've spent a lot of time teaching folks in outpatient environments, sedation dentistry environments, med surge, medical surgical floors, where they go, oh, we're just going to call the rapid response team. Well, while you're waiting for the rapid response team to show up, your patient's crashing and burning, and you need to put out that fire and save them. If you're in an outpatient clinic, you're waiting for EMS, emergency medical services, 911 to arrive. If you do work in an emergency room or pre-hospital advanced life support office, or you work in a critical care ICU, the deal here is this is above and beyond your normal industry standard certifications in advanced life support, whether it's adult or pediatric. So it doesn't matter where you work, this is appropriate for you. And it doesn't matter what your level of professional licensure certification is, it's appropriate for you. I've seen nursing assistants and medical assistants and EMT basics code patients, all the way up through board certified physicians with multiple fellowships under their belts. So wherever you work or whatever letters are behind your name, the reason that you should get certified in this is because we call it the practice of medicine, but you really shouldn't be practicing when your patient's trying super hard to die on you. You need to be ready for it before it happens.
Yeah, sounds very important for people to have the proper education to be able to handle those situations quickly when they come up.
Exactly, the art of medicine versus the practice of medicine. If it was your mother that was dying, would you want someone practicing on her? No, you would want someone that had honed their craft to an art, and that's the aim of this course. Is if you have no knowledge, we're going to give you, above and beyond what you need for your standardized resuscitation courses. And if you've taken those standardized resuscitation courses, even at the experienced provider level, this is going to add to what you already know and make you even better at what you already do.
Great. Well, thank you. All right. Our next question for you today is so, what is unique about this certification? So, you're kind of, I think, touching on it a little bit there, but if you can expand a little bit more on what makes this so unique in the marketplace.
Yeah, absolutely. So usually when you take one of the industry standard courses, there's a set course rubric, a set amount of things that you're going to learn and why you're going to learn them, and they're taught at a lowest common denominator level. Okay, and there's reasons for that. I don't mean that as a negative. Okay, those courses are simply by their very nature limited in their time and scope. What's unique about this course is it's 3 times longer than any of the, well, actually half again longer. Most of those courses are 2 days. This is 3 days worth of material. The other thing that's unique about it, I'm not real big on talking about myself, but I do have a rather unique career trajectory, starting out in molecular biology, moving into nuclear engineering technology, then high performance teams, process improvement, quality improvement with military aviation, NASA, etc. Obviously, we also did a lot of that in nuclear engineering technology in the Navy. And on top of that, I hold all of the industry standard instructor certification, actually instructor trainer certifications, in addition to multiple board certifications across the age spectrum. So all of that comes to play in what makes this course unique is it's half again longer than any course you'll take, but it's next level, grad school level physics, physiology, pharmacology from that molecular biology, nuclear engineering, and advanced healthcare provider perspective. But here's the kicker, it's next level grad school knowledge, but we make it real, relatable, and most importantly of all, relevant to your bedside practice. Okay, so theory is useless without clinical application. Yes, I will teach you next level knowledge, but more importantly, I will teach the students why and how that next level knowledge can improve their patient outcomes.
Perfect. So then after somebody goes through your course, they get the certification, and with that credential, they can demonstrate that knowledge that you were just talking about to, share with their patients and, potential employers if they're seeking out, jobs in different capacities that, hey, I've gone through this rigorous training and have this certification to demonstrate that I have this knowledge.
And that it's over and above all of the current industry standard courses such as ACLS, PALS, ALS, Apples. In other words, all of these industry standard courses, they're wonderful, wonderful courses. And as I said, I hold instructor trainer certifications in almost all of them. They're wonderful courses, but by their very nature, they're limited in their time and scope. So when your employer or potential employer says, well, hey, what is this rapid response healthcare certification and why should I care? You can come back and say, well, this actually builds on all of those industry standard certifications, and it's taught internationally. I teach it around the world. I have numerous scientific publications and presentations at very prestigious large international conferences on this resuscitation methodology. So it's also scientifically backed, vetted, both nationally and internationally. And it builds on the industry standards that you're usually healthcare facilities and providers are required to have for insurance purposes and reimbursement purposes.
Perfect.
So that's, in other words, why do you need this if you've already got that? If you already have the industry standard certification, why would you want to do our rapid response? Because it's going to make you even better at it.
Perfect. Absolutely. All right. Our next question for you. So I think this was a good segue because we were kind of just getting into this conversation here of what professionals would benefit from this certification.
And that is a great question because, of course, once I say the words graduate school level, people freak out, right? And they're like, oh my God, this is going to be over my head, or this is going to be tons of theory that's useless at the bedside. Let me put it this way. In one of the level 1 trauma center ICUs that I used to work at, I taught the housekeepers, the environmental services staff, how to interpret blood gases and do basic ventilator adjustment. Okay. I also teach those classes to board certified MDs with multiple fellowships under their belt. So when the same thing applies to this information, okay, I've taught this information at the appropriate level to Haitian security guards who haven't even graduated high school, all the way through board certified MDs with multiple fellowships under their belt. In terms of healthcare professions, everyone from a nursing assistant, a medical assistant, an EMT basic, a paramedic, a respiratory therapist. I've had nutritionists, physical therapists, occupational therapists, nurses, nurse practitioners, physician assistants, and physicians. So pretty much the entire spectrum of nursing, medical, and allied health, this course is for you. And it doesn't matter if you're just entering the profession or you are at the peak of your professional trajectory in terms of education and experience. This course is for you.
Absolutely. So the education is really appropriate across the spectrum, and then the certification is really for kind of those professionals who are really working in those rapid response roles and in the ICUs and ER in areas like
And
that.
even if they're not in a rapid response environment, that's why I went to the point, made the point of mentioning that I have taught this in outpatient environments like sedation dentistry, family practice clinics. I've routinely taught this to medical surge floor nurses as opposed to unit nurses, right? In a unit or in the emergency room, we usually run our own codes. Outside of that, yeah, absolutely. Cath lab, OR, med surge, and then your med surge units are split up depending on their speciality. So it's not just for ERs and ICUs or emergency medical services outside the hospital in the pre-hospital or critical care transport environment. It is literally for any and every one.
Perfect. I think that kind of ties into our last question that we've got for you today is about where these certified professionals can work. So are there any other realms? I know you're saying it wasn't just limited to the ICUs and ERs and things like that. Are there other ones that we haven't touched on areas where these certified professionals?
Well, we've touched on all of them, Nicole, but what I'd like to point out is that this course would be a real selling point and in addition to anyone's CV or resume, particularly in, we call it a low volume, high technical situation. So, for example, those outpatient clinics, right? You're like, okay, yeah, we're not going to routinely see codes. Well, that's exactly why it's a selling point if you have this and you're applying to a job in one of those places. Because you can be like, yeah, we're not going to see it very often, but when we do, by God, I'm ready for it. Okay. I like to call them halo, right? High acuity, low occurrence. That sounds a lot more friendly than low volume, high technical. And then, of course, for folks that do work in those high acuity, high volume environments that you mentioned, like pre hospital advanced life support transport, critical care transport, emergency rooms, ICUs, again, this will definitely take you to the next level in your practice and in improving your patient outcomes.
Absolutely. Yes, so we've got the link there if you want to learn more about the certification. And then we have a link to the course that Sean was talking about that leads to the certification. You can find that right there on Evergreen's website. And we are excited to introduce the certification to the world and get more people certified and share this knowledge with everybody because that is really so important for all of these professionals to be able to handle these situations when they come up, so unexpectedly and quickly.
Absolutely, absolutely. It's been wonderful partnering with you guys, and I look forward partnering with Evergreen, and I look forward to partnering with each and every student. That's another thing that's unique about this course is I do provide contact information within the context of the course, and I am always happy, as long as I can make room in my schedule, I am always happy to provide offline micro coaching, which is another thing that's super unique to any of my courses that you're not going to find in any other one. You take an industry standard course from a, big box provider, whatever. When you get that certification, you're done. You don't have the opportunity to go back to them and say, oh, well, I had this rapid response situation the other day and I have some questions, that I didn't quite get to debrief with my team. So, yeah, absolutely. It's been a real pleasure partnering with Evergreen. And as far as you listening to this and our potential students, it's going to be a real pleasure partnering with you. And again, that partnership doesn't end when the course ends. I provide you with my information, and you are welcome to reach out to me. Okay, I'm all about it, helping you improve your patient outcomes, both within the context of this course and in the context of your ongoing professional career.
Thank you so much for sharing all of that. And yes, if anybody that's watching has any questions, feel free to reach out to the Evergreen team. We're happy to help you. And then once you purchase the course to lead to certification, you'll get Sean's information and be able to reach out to him as well. So thank you so much for being here today with us, Sean. This is really exciting to kind of share this certification with everybody.
And actually, you bring up another good point, Nicole. I know we're up against our time, but also important is a question that people always have is about maintaining the certification. And to our potential students, just to let you know up front, this certification is super easy to maintain in terms of continuing education hours, and a lot of your industry standard courses will apply to maintaining this certification. So not only will getting this certification take you to the next level, but it's super easy to maintain as well. Okay, so again, thank you so much for your time. I look forward to seeing you within the context of the pre-recorded course, and you are more than welcome to reach out to me with debrief scenarios from any rapid responses you have participated in or that you anticipate participating in. So again, thank you very much. I really appreciate y'all.
Thank you.